In this video, we'll start discussing the physical, cognitive, and emotional development that occurs starting with infancy going through early childhood. While we aren't going to go into all the details of fetal development in this class, I would say that for, say, a developmental psychology class or developmental biology class, I do want you to be aware of the amazing things that happen during this time period. So we start off with a fertilized egg at conception being no larger than a pinpoint. And if you think about that, then in the next 40 weeks, that pinpoint fertilized egg develops into a, let's say, an average 8-pound, 21-inch, 20-inch baby. That's pretty amazing. Starting with conception, this is called the zygote stage. And within 30 hours, you can already see we have cell division occurring. And this division continues to happen. And then after about 5 days, we actually have more than 100 cells. Next, we go into the germinal stage, which is week 1 to 2. And at this point, most people don't even realize that they're pregnant. Once we get into week 3, we call it the embryonic stage. So week 3 to 8 is the embryonic stage. And then when we get into week 9, we call it the fetal stage, and we call it the fetal development. And this is close to the end of the first trimester. We start to have different tests done. Prenatal care is really important. And so this is just kind of a little diagram going through the different stages. By 12 weeks, we have the sex organs differentiating. By 16 weeks, we have fingers and toes, hearing at 20 weeks, lungs at 24 weeks. The brain starts to grow really rapidly in that third trimester, starting at 28 weeks. Bones are fully developed by 32 weeks, muscles develop by 36 weeks, and then 40 weeks is what we consider a full-term baby. You can also see here that by 16 weeks, the developing fetus looks much like a full-size baby. The brain nearly doubles in weight between 16 weeks and 28 weeks, although there is a lot more brain growth that happens during this stage. When the baby's born, the brain weighs around 300 grams and has all the 86 billion neurons that we're ever going to have, minus a little bit of neurogenesis that occurs in the hippocampus and the olfactory bulb. So there's a lot of things that we could talk about during this fetal stage of development. What we're going to focus in on are teratogens. So teratogens are environmental agents that can cause harm to the developing fetus. So I want you to be aware that the baby is fairly safe in the womb. The placenta, which is where the developing fetus gets nutrients from, can also let some other harmful things in that the mother might be exposed to or ingest. And so that's why it's really important to be careful about your health when you're pregnant, get prenatal care, make sure you have regular checkups to make sure everything is developing normally. So we're going to talk just about a few of these teratogens. So there are toxic chemicals such as lead and mercury that are associated with miscarriage, stillbirth, low birth weight, and premature birth. So higher exposure can cause more severe disorders such as even something like spina bifida. So here's just showing you different fish and the mercury levels. So the bottom dwellers have the lowest amount of mercury levels, and the highest would be the ones that are higher up. And it's safe to eat a certain amount of fish when you're pregnant, or even of pregnancy, childbearing ages, right? You don't want to, because you don't always know when you're going to get pregnant, but in moderation, because fish is a good source of protein and healthy for us. That's mercury exposure. Lead exposure typically comes from old pipes or paint. And so, if you live in an older house, like when, they talk about it when you're in prenatal care, but when your children are born too, they ask you, how old is the house that you live in? They'll check for lead levels in the child. So my children, because we live in a house born in the 1940s, they had their lead levels checked. I believe it was once a year until they were of a certain age. So another teratogen are sexually transmitted diseases. So if these are left untreated, they can cause things like mental retardation, blindness, and other physical disorders. So again, this is why early prenatal treatment is important. Typically at your very first prenatal appointment, they'll screen you for a variety of STDs. Doesn't matter, how long you've been married, what your situation is. And of course they ask you, if you don't want to be screened, you won't be screened. But even with my third pregnancy, I had been married at the time for 16 years, I was screened for STDs. Another teratogen is cigarette smoke. So I think most of us are aware today that smoking, whether it's cigarettes or vaping or really any type of nicotine, is not good for a developing fetus. So nicotine increases the risk for miscarriage. It can cause a lower birth weight, can cause premature birth. and lead to problems sometimes that aren't seen for years. And so they even say it's not necessarily even just the smoke that the mother inhales, but when a baby is born, smelling that smoke on clothing as well can also cause some difficulties. So alcohol is another teratogen. And again, it's kind of another common sense one. Most of us are aware that, have heard that women shouldn't be drinking while they're pregnant. Of course, in some parts of the world, women continue to have a small glass of wine every now and then. The truth is, we really don't know how much is too much, but it's simply not really ethical to take a group of women, give one group no alcohol, give another group 1 drink a day, another group 2 drinks a day, another group maybe 6, and just see how messed up their kids are. That's just not ethical. We can't do that. So we do study children that have something called fetal alcohol syndrome. We can look at retrospective accounts of how much the mothers drank, and we know that the alcohol-related effects are on a spectrum. But an individual with fetal alcohol syndrome, they have a low birth weight, typically a smaller brain, some very stereotypical facial abnormalities that you see here, or deformities, I should say, lack of coordination, mental retardation at times. And again, but it's on a spectrum. So it seems to be the common theme is the more the mother drinks, the more severe the problems, the less severe. And it also has to do with the timing of the alcohol ingestion, because again, certain things are happening during fetal development at certain times. And so here in this diagram, you can just see some of the things to point out would be a shortened nose, a low nasal bridge, indistinct philtrum, which is a little kind of like bump in like over your lip. Individuals with fetal alcohol syndrome typically don't have those. A thin upper lip, but that doesn't mean that everybody that has a thin upper lip had mothers that drank. Now, fetal alcohol syndrome is a leading cause of non-genetic mental issues, and it's at the extreme end of the spectrum with, again, like with other alcohol-related defects. So we also know that drugs other than alcohol, both illicit and over-the-counter, which not everyone's aware of, can also cause problems in the developing fetus. So anything from Motrin to cocaine can lead to a variety of developmental health issues. So a lot of times people don't realize that over-the-counter medications come with their own risks. And so, they'll tell you that sometimes they always said the Tylenol is really the only safe thing to take, and now I think they've kind of retracted that. They kind of go back and forth, but drugs have a safety recommendation based on pregnancy, based on the type of testing that's been done. And so it's important to realize that. And as I said, not everyone does. So before we had our children, we had some infertility issues, and we were actually trying to adopt. And it wasn't somebody that we were talking with, but there was somebody in a group that I belonged to who had been talking with a birth mother, and they got the call that the mother was in labor. So they flew up. It was pretty far away. I can't remember if it was the Pacific Northwest, but I actually want to say it was almost like Alaska. So they flew a long ways to meet the baby and bring the baby home. And when they got there, the baby had actually passed away. And it was because the mother had taken Motrin on a regular basis. And so the baby was born with bleeding on the brain and died from that before they got to the hospital. So again, just letting you be aware that it's not just illicit drugs like cocaine and amphetamines and things like that. Over-the-counter drugs can also be risky during pregnancy. So you always want to check with your doctor.